Just 1 second.
Sure, take your time.
My phone may die, so. Yeah.
Okay.
Okay.
Dear members of White Army, in the continued series of our career counseling sessions, with a huge demand from our members, we have arranged this special session of Ophthalmology Residency. And when I heard about this particular topic, I couldn't find a better mentor than my own senior from Bengaluru Medical College, who went on to do MS in ophthalmology and also then did her fellowship in cataract and refractive from Rajiv Gandhi University, a celebrity model herself, and most favorite senior of all the BMCites, Dr.Dishitha Rathod, madam. And she's here with us. Just a few days back, she has finished a conference in the US and returned. And when I requested, she readily agreed to be with us, guiding the juniors, budding ophthalmologists, and express her insights and valuable experience with us. Thank you, madam. Thank you for joining this session. Thank you.
Thank you, Kishan, for the wonderful introduction. And we can start off whenever you want to.
Madam, the first and foremost, as an undergraduate, I had a little bit of exposure to the ophthalmology during my third year MBBS.
Correct,
but still, to make it a career branch, okay, whether to take up ophthalmology or not, it's a huge decision. So
correct.
Please tell me why I should be taking up ophthalmology other than passion. What are the advantages added to it?
Right. So firstly, you spoke about ophthal in undergrad and internship. The amount of exposure that we get during internship or even say in undergrad is very, very minimal.
Yeah.
Ophthalmology in itself is a very vast subject, although you think it's just a small part of your body. It is actually the window to the entire body in itself. There are various parts in it, there are various subspecialties. So to choose a path, and why would you want to choose a path in ophthalmology? For a lot of people who are technology driven, who are who like to be with gadgets and things like that, it's a wonderful field, because anything and everything in ophthalmology needs a lot of equipment required, right? From just a simple examination, which needs a slit lamp, or to look back into your eyes in the form of fundoscopy. There are various instruments that are involved. Second thing is, for those people who want to choose a path in between surgery and in between, like being a surgeon and a physician, ophthalmology is a great subject because you can operate. It is a bloodless, almost a bloodless surgery. And you also have the physician part of where you really need to apply your brain in certain aspects of it. So in ophthalmology itself, you can choose various paths. And lastly, it is not a emergency subject, which means you can decide your timings, you can decide how much you want to be involved, how much money you want to make, where you want to study. There are various options. And so yes, it is definitely a great option. And having said all of this, I also want to highlight that in ophthalmology, it is a very women-driven field at this given point. If you see in any medical college, the ophthal department is female dominated.
Yes.
Or even in the hospital where I work, we have probably 3 male doctors, and the rest of the consultants, say 8 consultants, are females. So yeah.
Yeah, to be honest, even I had opted for ophthalmology at first. I was also so much fascinated by this particular branch, just like Dishitha madam told, same aspects, like it's a microsurgery, very challenging. Secondly, yes, you do 2 cataract surgeries per day and rest of day is all yours. You can spend however you want. You make enough money for the day and you can spend time, your hobby, you can pursue your hobbies, all those things. And whatever cases may come down in the world, cataract cases will not ever come down. So in that way, uh, 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 ophthalmology is evergreen branch. So always you see patients wherever you go and wherever you practice. So all things I consider before opting
Kishan,
for it.
can you just ask the
Yeah,
other
I'm
person to
muting
mute
him,
it?
muting him.
Yeah.
Yeah. So all these things I consider before opting for ophthalmology, and somehow, just like Madam pointed out at the same at the end, my cousins there in the family who are already ophthalmologists. My cousin sister, she told me, no, same point. Kishan, this ophthalmology is more of women driven, mainly
No,
for
but
doctors.
having said that, okay, I'm sorry to cut you out. But having said that, it does not mean that there are no stalwarts in ophthalmology. In fact, all the biggies are men at even at this given point. You know, all the ones who've made it big or are on top are still the men out there. So yes, it's definitely a great field to explore in terms of gadgets, in terms of instruments, in terms of, and also it's growing so vastly in terms of technology. It's
Lasers.
it's brilliant. Yeah,
Yeah. And no, it's for a reason. It's not simply ladies driven or women driven. For a reason, there is that it's a meticulous surgery, ma'am. Like, see, in here the margin of error is very, very minimum, and it's such a fragile organ of our eye. There is no scope
yeah.
for revision surgery or second surgery. And
No,
patient
there
for a
is not.
patient, eye is the like a life. Even if you lose
Correct.
one
It
limb,
is
you may cope up. But if you lose his vision, it's like his entire life is gone. So there is margin of
correct.
error
He's
is
quite
minimum
handicapped.
during any treatment or surgery. So, and ladies are more suited for these kind of meticulous surgeries and very, what to say, meticulous movements. So in that way also they are more suitable for ophthalmology. What's your say?
Absolutely, that's right. But it's not true that only ladies can do very fine surgeries. I mean, there are men, I've seen excellent male surgeons as well doing excellent surgeries. In fact, two of my favorite and fastest cataract surgeons are men at this given point. So you are right in that aspect, but it is also a wonderful field to be in because, like I said, you can choose your timings, you can choose how much you want to be involved in, you can choose to what level you want to innovate, to what level you want to, be scientifically involved also. So it's a wonderful field, all in all.
And ma'am, is that I have decided to take up ophthalmology. And the
Yeah,
first thing comes into my mind is which college, where to take up, whether to go into a medical
correct.
government college or a private college, where
Yeah.
there is better facilities are available, or whether to take up a
Hmm.
central institute or a state medical college, whether to do MS or DNB. So all these set of situations.
Hmm. So we'll talk about each of it in order. So first is which institute to choose. In most given cases, you may not even be able to choose. I mean, there will be a handful of people who will have that privilege.
Yeah.
And for them, I would say definitely a national institute or the regional institute, you will have a lot more hands-on. You will have a lot more to learn from. I mean, in your internship, whatever you've studied in 4.5 years, you only implement and learn the maximum when you're on field, when you're in clinics. So in that way, the number of patients that you get and the number of things that you learn from them is definitely better in a regional institute or a national institute. Secondly, given the subject that it is, you have to look, it's a you have to look inside the eye, you have to look at the eye on various microscopic levels. So there's no amount of, videos and things like that that'll do justice to teaching compared to you looking into an eye and learning by yourself. Because it requires a good amount of stereopsis, depth perception. All of these things only come when you are hands on with the patient. So definitely look at a place where there is good OPD numbers. It goes without saying, make sure you have good teachers. And yeah, so these are the things you look at when you look at what institute you want to choose. Having said the next question, DNB or MS? Of course, MS is more recognized and they obviously say DNB is a lot more tougher. But I think the bridge or the gap in between that is definitely becoming much lesser these days. An MS person is as good as a DNB person, if not better, and vice versa. Even the DNB institutes are also doing great. The one advantage with a lot of DNB institutes is a lot of them have a lot latest technologies and things like that, and they also have a lot more you get a lot more experience in terms of dealing with patients in, say, like a private sector, because the kind of patients we deal with in regional institutes or national institutes is very, very different compared to what you would deal with on a normal basis, supposing if you had your own practice. And it is quite a big challenge. The kind of queries that they come with, the way you need to handle them is something that you are probably taught better in a DNB institute or in a like a private place. And what was the other
Yeah,
question?
that's it. MS or
These are the ones, right?
DNB.
Yeah. And the other thing is, of course, the exams. I obviously felt MS was a lot easier because you are giving it, say, in your institute or places that you know, and you know it's a set pattern. With DNB, it's a lot more challenging for sure. And I haven't personally given the DNB exams, but I know a lot of my colleagues who have already given MS and DNB as well. And once you've cracked one, cracking the other is not really a big deal at all. And once you cleared your MS, you don't even have to officially, go through a whole training period. You can just give your exams for DNB as well. So it's just a matter of that. The other thing I want to highlight is if you do want to join the government service, in that case, obviously, MS holds a lot more weightage than DNB. Recently, I did apply to Bowring Institute, and I don't think they had an option or they had enough weightage for a DNB graduate. I mean, postgraduate. So that is something that we will need to look into a little more in detail. I don't have too much information on that. I just know from personal experience.
Madam, just that now I have got a ophthalmology seat in any desired college. What should be my preparedness, both mentally and physically, and what should be my strategy to encounter these 3 years of residency? What should be my strategy in first year, second year, third year, dealing with the patients and with the studies? Because ophthalmology, even though it's a very small organ, but it's the most vast subject. For example,
Yes,
for
and
retina,
very
for
rightly
10
said.
layers, you have 10 separate different voluminous books. So it's not so easy. Ophthalmology,
It
just
is
like
not as
how it
easy. Yes,
looks superficially, very
exactly.
vast
Yes.
and very intricate. So in
In
that way,
fact, the retina is such an amazing organ that anything systemically that is going on in your body can be picked up in the retina if you know well enough, if you are well read enough. So, you're right. What is most important in terms of um, getting into studies and being at the top of your game when you start, supposing you've started today? Firstly, for the first few days, test the waters, see how you feel. Try to understand the patients. Patients in different areas are going to be different. Supposing you have done your PG, say, in the south of India or even in the south of Karnataka, and you go to the north, they are completely different. So, first few days for you to mentally get into the entire ball game of it itself will take time. Understand your teachers and understand your colleagues more than whatever books you're going to read. Of course, books will give you all the bookish knowledge that you need, but being on good terms with your colleagues and with your mentors makes a lot more difference than just having knowledge from your book. Having said that, of course, there will always be a yearly pattern, yearly syllabus for you to study and things like that. Even when they start surgeries for you, it will always be a stepwise process. The each institute will have its own way to do that. Like when I started in my MS, initially we would just go to the OT and, help out with the seniors, get to know how the whole process of OT runs. The thing in ophthalmology is there are a lot more patients that you deal with in a smaller amount of time than say in surgery or like in general surgery or anything else, because surgeries are much shorter. So how to quickly move with the patients, how to ensure you've checked their lenses, how to ensure you've checked the machines are working, all of that itself is very important than just getting directly into surgery. Then you start stepwise with learning how to give the anesthesia, which is the most first step that you learn, and so on. They will start teaching you steps of cataract surgery, because cataract is the most basic surgery that everyone knows. Usually, some institutes start off with ECC, then move on to SICS. Some institutes also to phaco. Of course, phaco surgery today is the most commonly done surgery in the private hospitals, and even otherwise, I think phaco is something that is being favored. Although SICS is something that everybody must know, so do not ignore SICS and the steps of it. Phaco may seem easier, but knowing an SICS will save you on the worst days. And that's not the only surgeries. Of course, there are a lot more surgeries, lid surgeries, lacrimal surgeries, various surgeries, squint surgeries. So all of these things are there. Stepwise, look into it, learn, observe, and yeah, and at the end of probably in your final year, you will get opportunities to do all the surgeries. Just getting back to one important thing that I forgot when you asked me with regard to, what institutes to choose. In my experience, I did my PG in an institute which also had other specialties, like the surgery, medicine, everything. It was a teaching hospital. In that way, you are well connected with other departments. You do not have to refer your patients. Supposing there's an accident patient that comes to you, you have other departments supportively with you to get to your eye part of the surgery. But supposing you are in a solely eye institute, you may have to refer these patients, and then whether they come back to you later or not is a big question. So I feel like I gained a lot more knowledge and hands-on experience being in an institute with other departments as well, because I did n number of lid sutures, because we had lid suturing, because we had a lot of accident cases. So those things also matter when you decide where you want to pick your center.
Is this ophthalmology residency very stressful? Because
Not
you
at all.
the amount of patients every day, you do 30-40 cataract surgeries and minimum
Yeah, I mean, we've
maximum
also done
patients.
100, we've also done 100 cataract surgeries in a day, but that's not every day that you do. Sometimes there are camps, or sometimes it's just that, patients believe that in certain seasons it's better to get operated, especially in smaller towns, this happens. So it's definitely a challenge, but it teaches you a lot. And it's a great learning experience. It wasn't really, I wouldn't say stressful, but of course, you won't learn anything unless there is some amount of stress, and that's what PG is. And then you go to fellowship, there's a whole different kind of stress that it comes with. So I feel like, compared to other departments and things like that, yes, you have very little stress, because 99.9% of your patients are not going to die. So that is one big, you don't have that looming fear about it. So it's fairly less stressful in those terms. But of course, if you are a type A person, you are always going to be worried and anxious whether, after surgery, your patient is going to reach 6/6 on day one or not. So that is also another aspect of the whole thing.
Now, if you have small tremors and like because of anxiousness also, or otherwise also, some people have these tremors. So
Yes.
are they suitable for ophthalmology microsurgeries?
I would say not, because, like you said, it is microsurgery. You are operating in, say, like 5 or 6 mm of space. So you know how precise everything has to be. So definitely tremors and people who do not have good stereopsis or depth of vision is not this is not the field that you should choose. Of course, there are various other options in terms of what you can specialize in, but this I would say may not be the best. Having said that, it does not mean that every cataract surgeon has to operate. You can just be happy with looking at OPD, picking up things or referring and things like that. First of all, the most important thing is to know all the fields, or at least be a jack of all trades in terms of glaucoma, squint. You need to know everything about everything, or at least something about everything, to know what to do next.
Yes, yes.
Right? So that also is a big challenge.
Now, just that you finished your MS and did your fellowship in cataract and refractive, and then now you are a consultant in a very famous institute, Narayana Nethralaya. You are a consultant ophthalmologist. So, what are the
Right.
other way forward, madam? What are other options you have after the
So
MS? Can you do super
um
specialty fellowships, or directly you can practice?
so yes, you can directly definitely practice as well. You can practice as a general ophthalmologist soon after your MS or DNB, or even after your DO. I know a lot of people, not in my batch, probably say a few years senior, who have just started off with their own private practice and things like that, and are doing excellently well at this given point. So you it depends on your interest, it depends on what your future plans are. If you want to have only your own center, and you only want to do cataracts, then yes, go for a great place where you can get your cataract training, your phaco training, and come back and start. If you are going into an institutional practice, again, choose what you want to do. In doing a fellowship or having that under your belt is definitely has a lot more weightage than just going in as a general ophthalmologist. So yes, there is space for general ophthalmology as well. If you do not want to specialize, if you do not want to waste another 2 years of working as a student and slogging it out, you can always start working. And whenever you feel that yes, this is what I am interested in and this is what I want to do my fellowship in, you can always do your fellowship even at that time. The eye itself has so many fields that it's not easy. You cannot wake up today and say, this is what I want to do, this is only the only thing that I want to specialize in. I would say understand everything, learn everything in your post graduation or in your DNB, and then decide what suits you best, where your interests lie, whether it's oculoplasty, cornea, cataract, LASIK and refractive surgery, or retina, or just squint and neuro-opthal. There is so much, and there's only pediatric ophthalmology as well. So it's a vast field.
So, ma'am, you are a third generation ophthalmologist in your family, and Dishitha madam's mother, Dr. Sujata Rathod madam, my teacher, and also head of the most prestigious Minto hospitals in Bangalore. Okay, now she's a DME as well. She's also a very good and excellent ophthalmologist, and Dishitha madam as well. They are all successful in the career, and now the madam also doing well in the beginning of her career as well. So, can you please give me some secret tips to be that most successful in your career as an ophthalmologist? What is the key features required to be that?
I don't know. I wouldn't say I am successful the way you are telling me, but I'm going to take a few tips that I learned from my mother, and how I have seen that, she has been able to stand apart, or, been a favorite among students itself.
Correct.
One is definitely being a good teacher. Giving opportunities to your students is something that will take you a long way. If ever anybody gets an opportunity to be a professor and things like that, make sure you teach well and spread the knowledge well. That is a great way to learn the subject and keep it at your fingertips. And of course, you're doing a great service by teaching others. Secondly, you have to keep up with the game. Ophthalmology is progressing in leaps and bounds. Okay, what probably the surgeries my mother was doing is probably obsolete now in terms of ECCE and things like that. When they did their PG, they didn't even have IOLs to be placed inside, and now we are in the stage of foldable IOLs and light adjusting IOLs. Like technologically, it has advanced a
Highest
lot. So
advancements.
you need, yes, you need to be
Good.
equip yourself with the latest knowledge, learn the latest techniques that will keep you on top of your game.
Excellent. Very well said, ma'am. Ultimately, what's your
And lastly, of course, you have to treat your patients as if they are your own. It does not work, it does not help if you are just doing it, you know,
for sake of
out of, yeah, for the sake of doing it, or just for money, or for whatever else reason. There has to be compassion in what you do. You have to like what you do. You have to treat every patient as if they were your family. What would you do for them if they were your family? That is the best way to, of course, sorry, there will be patients who will come with vague questions and who might, take a lot of your chair time and things like that. But it is important to be a little patient with them. And, of course, over the years, you will find out how to manage them in the nicest way. If you look at some of the very famous doctors, Dr. Devi Shetty and Dr. Bhujang Shetty, some of my mentors always talk about how whether it is 8 a.m. or whether it is 8
correct
p.m., 9 p.m., 10 p.m., Dr.
approaches.
Devi Shetty will talk with the same amount of patience as he did to the patient he spoke in the beginning of the day. So that is something that I need to inculcate myself. And I think that is what sets you apart.
Yes, ma'am. And see, in ophthalmology, the patients have a lot of expectations. Okay, the patient who was,
Definitely. The
yeah,
expectations are out of bounds.
after the surgery, they expect it to be perfectly 6 by 6 all the time.
Yes.
So
Yes.
sometimes it's not possible to give such a good like vision after
Hmm,
the
hmm,
but
hmm.
patient's expectation, and when you cannot meet. So how do you deal with such situations that patients are not happy, they're not satisfied, they'll be keep crumbling, and so
Of course.
not only
See,
in ophthalmology, in any surgical field
it
for that
happens.
matter.
Yes.
So what's your tips to deal in such a situation? It's very demotivating for surgeon as well as it's a sad
You're right.
situation for a patient.
You're right. And it'll also spoil your entire day. You're not in the
Reputation.
best
Yeah.
of mood to deal with your next patient. So what I believe in is you under promise and over deliver. That works the best with patients. Do not promise the sun and stars to them. Don't say yes, you will definitely see 6/6. Be honest with your patients. Like when I have a patient who needs to go for a multifocal IOL, some of the multifocal IOLs come with their own set of not drawbacks per se, with their own way of getting adjusted to and things like that. So be transparent. Tell the patient, yes, it will take time. You may not see 6/6 right on the day that you get operated. Now, if the patient sees 6/6 on day one, that's
Maybe
excellent for
more than that.
you. Exactly. But of course, it's a surgery. There are a lot of variables. There are a lot of things that can happen. There can be swelling, there can be XYZ things that can happen. So you need to be careful. Educate your patient about the surgery, about how it's going to happen, what are the outcomes, how the patient himself needs to put in his effort to take care in the recovery period, because everything is not in your hands. They have to work equally in the recovery period for things to get better. So it's good to make them a part of the entire healing process as well.
And the beauty of ophthalmology is at the end of the day, when you're an ophthalmologist, you can choose to be like what you want to be yourself. Like you can be sitting in the OPD, already madam mentioned. You can be just doing the OPD business and you can be happy. Or else if you want to be a hardcore surgeon, you can do that also. And maximum technological advancements have come in the field of ophthalmology, be it
Ophthalmology.
lasers
Yes.
and other stuff like IO, different variety of IOLs and all. So there's maximum advancements are happening in this field, so you can choose a lot of options also there. But
Yes.
having said that, madam, there is one big problem or competition from the in the field of refraction. Maybe from the refractionist nowadays, nobody is going for a qualified ophthalmologist for getting their vision checked. Instead, they directly go to a spectacle shop. There only they have this machine guided.
Yes.
That's a lot of, even for a beginner also. So,
You're right, but of course, these kind of setups are there. Like we have our lens cart and all of these things which are there, and I feel like a lot of people do think that it is taking away from you, but there are various things that they cannot pick up. So make yourself the master of something that they cannot do. An ophthalmologist is not just like an optometrist. An ophthalmologist is not only there to see your number and give it to you. Now, if somebody else can do that and can just dispense glasses, it's fine. But of course, when the patient has a bigger issue, they will come to you. The optometrist cannot handle it. They cannot even handle high cylinders, and they send the patients to us. So no, they're definitely not taking over ophthalmology in any sense of the way. I would say in certain ways they are helping you with, just the basic glass prescriptions, and they cannot handle a cataract surgery. They cannot do refractive surgery. So all of those cases are going to come to you. So I don't think they are a competition in any way.
Yes. So yeah, we had this initial fear of all the optometrists are taking away our patients and all. Yes, it's a big chunk of other patients, other set of patients are waiting you. So don't look at the
Yes, so
only.
you also these patients with just glasses are just for glasses. I understand in a lot of private setups, your revenue comes from that, but also you will get more time to dedicate to patients who need surgeries,
Exactly.
which also can be a source of income for you if that is the only thing that we are looking at in terms of, like lens cart and things like that taking over.
Ma'am, what's your future plans like? Like you want to set up your own eye hospital, like just like Bhujang Shetty did.
No, I
What's
don't
the
think
future, like,
I mean,
what you aspire to become, or what's the future
at
plans?
this given point, I don't aspire to have my own hospital because I know how much of tension it takes. I still have a long way in perfecting my own craft. So that is something that I'm going to continue to strive to do for the next couple of years. And once I feel confident enough, then I may, think about it. But that's definitely in the very, very distant future. And I don't want to even think about it right now. I'm happy with where I'm working. I'm happy with the opportunities that I'm getting, the learning, the teaching, everything.
Correct.
So at this given point, I'm going to take that as, a bonus and work on it.
And setting up our own, like own setup is
Hmm.
how is it, madam? It's a very like what to say, a lot of investment is required for
Um,
because every gadget
there is
what you told is very cost expensive. So
Correct. So, setting up an ophthal setup is expensive because you need right from just your basic OPD examination to, just the entire setup of that itself is expensive. But you do have good return on investment for all of these things. If you want to have just an OPD setup, you can. If you want to add an OT to it, yes, definitely it will be an initial investment, but you can recover it fairly easily. So more important than thinking about the money that goes into setting up a hospital, I think it's important to perfect your surgeries and perfect your OPD skills and your skills of picking up things, because that is what is going to bring back your revenue to you. So
excellent.
that is important. And yes, depending on to what level you want to set up your hospital, whether it's just a basic hospital, whether it's with just cataract, or whether if you want to set up a refractive suite, those are very, very expensive. You have to work probably in tandem with a lot of companies that can help you out with. A lot of these companies have, I think, a sort of a share sort of a thing where they'll help you set it up, but you'll have to, implant their IOLs for your cataract surgeries and things like that. Since I don't have a setup, and I may not be the best person to talk about the setup part of it. But this is what I know from my friends and colleagues.
So at this juncture, I would like to remember my favorite ophthalmology teachers once again, Sujata Rathod madam, who has supported me immensely throughout. I was a class representative as well, so I had a very close proximity with all my teachers, especially Sujata madam and Chinmay madam, Kalpa, and so many else. Wonderful institute. I got an opportunity to learn maximum in Minto Eye Hospital from these great teachers. And Sujata madam was also our favorite senior there, and perfect all-rounder as well there. So she excelled in sports, culturals, academics, everywhere. So thank you so much, madam, for your kind insights and valuable time. And hope you will teach us more about the basics of ophthalmology in at your convenience in your near future as well. Thank you so much for being in this session and guiding a budding ophthalmologist. Thank you so much.
Thank you. Thank you so much, Kishan, for giving me the opportunity to be here. And I hope I've touched some minds around, and I'll definitely be happy to help in future as well. It's a
Thank you so much.
wonderful initiative, and I congratulate you for it.
Thank you so much. Thank you.
Thank you, Kishan.